Just okay, it's live now. Believe we're live. We're live, right? Okay. Assalamualaikum everyone. Unfortunately, we already had started the session, but we realized that वो live से ही बंद हो गया था. So sorry for the delay, but we're right on time still. So let's get started. My name is Soha Ahmed, and I am the international representative of Manzil Education Organization. And we have here joining us Dr. Rabail Tariq, who is the co-creator of Pakistan COVID Alliance Group, which is a new initiative that has recently been started by a number of doctors from around the world. Assalamu alaikum, Dr. Rabail. How are you doing?
Assalamualaikum. I'm good. How are you?
Alhamdulillah. So we're just going to go ahead and start. I just wanted you to give us a little bit of introduction about what you do and a little bit about what PCA or Pakistan COVID Alliance is.
So I'm a pediatrician and I'm training in pediatric ICU in Cleveland, Ohio. I'm also the founder for Pakistan Ventilators for Pakistan, and we were buying medical equipment for underserved and government hospitals in Pakistan. So we basically started Pakistan COVID Alliance because we thought that a lot of us were doing great work and we all had our own niche, and we felt that if we get together and collaborate, there's power in numbers and we can do much more if we are together. The main and primary aim of Pakistan COVID Alliance is to facilitate patients with COVID in whatever way we can. We are focusing on awareness, signs and symptoms. We have made protocols for treatment of patients. We're trying to facilitate people at home who are sick by answering their frequently asked questions. We are also trying to help them in procuring equipment like pulse ox and oxygen cylinders. And then we're working on a helpline which will guide patients at home. This helpline will also help us help patients getting to a hospital on time, because we realized a lot of people were going to the hospitals very late, and that was kind of affecting their health outcome. Apart from that, we have also collaborated with Shifa for You, and they have a virtual hospital clinic/clinic, and we will be providing them with volunteers to kind of help treat patients at home. So that's kind of what we've started.
And you're working with a whole bunch of organizations like Manzil Education Organization.
Yes,
as a
thank you so much
spokesperson,
for
we're
joining
so
us.
happy as a spokesperson of Manzil Education Organization on this great program that I'm definitely so excited to be a part of. I just wanted to know, basically, when you started, PCA, what were you seeing in terms of what was happening in Pakistan? Was that the main motivation behind starting PCA and basically treating people at home before they would end up going to the hospital, or giving them enough resources to be able to treat COVID at home?
Yes, so when I was on my organization, we were getting these messages day and night. People were desperately looking for oxygen cylinders, pulse oxes. They could not find hospital beds. And I saw a lot of misinformation on social media, a lot of people getting the wrong treatment, wrong use of medications. So I observed a lot of things which I thought had room for improvement. And that is why I kind of reached out to all of you guys and felt that there's room for improvement, especially in terms of guidance for patients there's a lot of anxiety surrounding COVID and a lot of mismanagement in terms of treatment, which I think can be streamlined through this platform.
Absolutely. And in terms of speaking, like on a global scale, obviously COVID-19 is like taken all over and everything. But specifically for Pakistan, we know that 165,000 cases have been confirmed to today. So in terms of that, because we have such a mashallah big following of Pakistani community and on Manzil, और मुझे पता है कि बहुत सारे लोग अभी देख रहे होंगे and eventually और देखेंगे, for them, what would you say would be the proper steps that are necessary to take in order to kind of bring some sort of a steady baseline for this whole thing?
Yes. So surprisingly, the the guidelines are very simple.
Mm-hmm.
So what you can do is you can protect yourself by staying at home as long as you can.
Mm-hmm.
Only go out for important and necessary things. If you go out and touch surfaces, sanitize your hands, but it's always better to wash your hands for 20 seconds. So wash them often. Do not touch your face, nose, and eyes, especially
Mm-hmm.
if you haven't washed your hands. Cover your cough with your elbow, and then put a mask on your face. So this mask just not doesn't only just protect you, it protects your loved ones because it contains your secretions and your fluids from getting in the air.
Mm-hmm.
And then keep yourself well informed. Do not believe the myths, research, and do not propagate news that you have not actually looked up yourself. Those
Mm-hmm.
are the things that will really, really help you. If you
Mm-hmm.
have any symptoms, just assume you have COVID until proven otherwise, because COVID can give you diarrhea, vomiting, all kinds of symptoms.
Mm-hmm.
So isolate yourself and talk to a doctor as soon as you have any symptoms.
Mm-hmm.
So
And
I think these
in terms of, you said that, really keep yourself informed from the proper resources. I know that Facebook पे आजकल बहुत ज़्यादा हो रहा है कि दवाइयों के नाम आ रहे हैं, मिस इन्फॉर्मेशन इतनी ज़्यादा फैली हुई है कि people are forwarding कि ओ तुम ये लो तो तुम्हारे कोविड नहीं होगा. There was this whole herbal case going on with different kinds of herbs being involved. And so as a doctor, what is your what do you call outlook on this kind of thing? How is social media really affecting us on this?
I think it's affecting a lot. Ek to, because all the COVID research articles are public, they're easily available everywhere. The
Mm-hmm.
problem with that is people read a certain medication and it says it promises a decrease in mortality, and they think if they just buy it, because in Pakistan you can buy things off the counter, they feel like they can self treat. But the thing is, all these medications have a lot of regulations and indications.
Mm-hmm.
I'll give a very small example. Abhi recently dexamethasone ka people have said that it's
Yes.
been approved. But if you take dexamethasone when you're healthy, your
Mm-hmm.
chances of getting sick are higher because it decreases your immunity. So dexamethasone helps if you are requiring oxygen and you have something called a cytokine storm, where your own body is has this hyper um, eh, like a extreme response to COVID and it's kind of shutting down your organs. In
Mm-hmm.
that case, that medication helps. But then because of this study, the people rushed to markets and bought it. I know there's a lot of anxiety that you won't find the medication if you get sick and all those things. But I also feel like you should be conscious about the people who are really sick and would need this medication.
Mm-hmm.
And you should not take it unless advised by a doctor because
Absolutely.
you
And
can get it.
exactly. And I think that's where Pakistan COVID Alliance comes in, because, we've created the page, we've created the, group that shows that, these are the proper resources and it's available to everyone to access. Am I correct?
Yes, and we have you know as well, a full team of doctors.
Yes.
We actually find guidelines and we get them checked by a number of people, and everything that we post on our page is very well researched. So
Mm-hmm.
you can be rest assured that you will not be misguided through the page.
Mm-hmm. And one question I had, just to clarify for PCA, people who are in Pakistan, they can reach out to these doctors for any sort of consultations.
So yes, so we have right now we have partnered with Shifa for You, and it's an online portal where people can check themselves in. Like if they
Mm-hmm.
call a number, and
Mm-hmm.
then they have a video conversation with a certified doctor who will help treat them at home for as long as they need to stay at home. So our thought process behind this is that the hospitals are so full. We want to
Mm-hmm.
treat patients at home the correct way as
The
long
correct.
as we.
Yes. Yes, absolutely. Okay, in terms of working with different organizations like Mansal Education Organization, I really wanted to ask you, how do organization like charitable organizations play into this whole initiative?
So all these charitable organizations are continuing to do the great work that they were doing. Like Manzil will continue with its school projects. I will continue with my ventilators project. But
Mm-hmm.
what we are doing right now is helping each other out. So
Mhm.
let's say I need help, like you're helping me right now with spreading the word or like with graphics or research. So all of us are basically just we have this intellectual collaboration.
Mhm.
We are still collecting our own funds. We're just helping each other out,
Mhm. Absolutely,
bringing
absolutely.
our expertise to the table.
Absolutely. So we just thought that having you on here on Zoom and just trying to talk with you for a few minutes would be a really good way to just get people involved, because a lot of people have seen our PCA posts, and we are so excited that Alhamdulillah we've signed a MOU with you guys, and we're really excited to be on this journey. I'm so sorry that this looks so long, but thank you again for being a part of our team, and what do you call, having us be a part of this new initiative. Inshallah, we're very very excited that this will go really really far. Obviously, if anyone has any questions, I think they'll be able to find the group on Facebook very easily. It is called Pakistan COVID Alliance Group. I'm sorry for that. And definitely, if you have any information, contact the group directly. Any last words you would like to say to those people who are watching this live session at the moment?
I would just like to say stay safe. Do not believe everything that's on the internet. Try to get your resources from World Health Organization and doctors.
Mhm.
Do not panic if you get symptoms. Contact a doctor. And there's a lot of anxiety related to going to the hospital. People think that they
Mhm.
will die if you go to the hospital, which is not true. If you go to the hospital at the right time, you this is very much treatable.
Absolutely.
So
Perfect.
I hope
Perfect.
everybody stays safe.
Inshallah, inshallah. We really hope that, ये COVID situation थोड़ी ठीक हो, and then, we can finally be able to see each other finally in person. So thank you so much, Dr. Abil. It was a pleasure having you here. And inshallah, we'll definitely be in touch with you.
No, thank you for having me and all the best to you and Manzil. And
Thank you, Dr.
you
Abil.
guys are doing a great job.
Thank you. Thank you. Chale, we'll talk soon. Okay. Take care.
Bye bye.